And the next item of business is a debate on motion 22985 in the name of Jean Freeman on COVID-19. Can I ask those who wish to speak in the debate to press the request to speak buttons? And I call on Jean Freeman to speak to and move the motion for up to 13 minutes, please, Cabinet Secretary. Thank you very much, Presiding Officer. Presiding Officer, yesterday the First Minister set out the further essential measures we need to take to control the spread of COVID-19 in Scotland. The First Minister set out steps we are taking to support those most affected by these measures and some longer-term actions to help us manage and live with COVID-19. These additional measures respond directly to the evidence provided by our Chief Medical Officer, our Chief Nursing Officer and the National Clinical Director in a paper that was published yesterday. This affects us all, and it is important that members can scrutinise our decisions and for us to explain these and, I hope, secure Parliament's support for our approach. Today's figures announced by the First Minister earlier, 1,027 new cases and tragically 5 further deaths, alongside yesterday's clear advice from senior clinicians, paints a stark and compelling picture. We are facing an exponential growth of the virus. The current rate of growth between 7% and 8% a day means that without further action by the end of this month, we could reach the same level of new cases that we experienced in March. As cases began to rise in late summer, we saw that increase focused in younger age groups. That meant we saw fewer hospitalisations and deaths. But that situation is changing rapidly, with cases in people aged over 80 increased by 60% in the last week alone, and cases for those aged 60 to 79 more than doubled. So the virus is beginning to reach again those who are most likely to suffer seriously from its impact. In the first week of September, there were 28 people admitted to hospital with COVID-19. 2 weeks later, there were 79. And in the week to the 4th of October, there were 212 admissions. Yesterday, we reported 309 patients in hospital. Today, that number is 377. In the first week of September, 2 people were admitted to ICU with COVID-19. 2 weeks later, there were 8. In the week to the 7th of October, there were 12. Yesterday, we reported 28 patients in ICU. Today, that number is 31. We are seeing cases all across Scotland, including in our rural and island communities. But reported rates are higher and therefore particularly worrying in 5 health board areas across the Central Belt. Greater Glasgow and Clyde today reported a 7-day rate of 190 new positive cases per 100,000 of the population. The figures for Lanarkshire are 168, for Lothian 125, Ayrshire and Arran 92 and Forth Valley 76. We are at the point at which the infectious pool of people makes it difficult to limit transmission without further restrictions to social interaction. The 7-day rate for Scotland overall is 101.4. For England, it is 138.2, for Wales 116, and for Northern Ireland 238.8. If we look elsewhere, we see that Scotland is continuing to track the situation in France with a 4-week time lag and Spain with a 6-week lag. We currently have half the number of new infections as France and a quarter of those in Spain. Death rates, though, in Spain increased significantly in mid-September and are now at a level 10 times the rate in Scotland. Both France and Spain have had to introduce strict new measures to reduce their rising number of infections and deaths, including even stricter controls on hospitality than we are proposing. So across the UK and mainland Europe, countries are facing the challenge of resurgence. Yes, I will. Alex Cole-Hamilton.
I'm very grateful for the Cabinet Secretary giving way, particularly on the issue of stricter measures around hospitality. I'm grateful for the movement today to allow cafes with on-sales licences to keep trading over the 2-week period in the Central Belt. But why can't pubs and restaurants that can provide safely food and soft drinks but not sell alcohol still have to stay shut?
Jean Freeman.
So, Mr Cole-Hamilton has in the past been critical, and entirely entitled to be so, that the measures that we introduced are confusing. We have to balance what we need to do in order to interrupt the progression of this virus with clarity of communication that is clear for the public to follow. That is why we have taken the steps we take. There is never, trust me, a perfect balance in all of this. Scotland is not alone in trying to strike that balance, but it is our job and our responsibility to take the decisions necessary to limit and reduce the prevalence of COVID-19. We are lagging behind other European countries precisely because of our success in suppressing the virus over the summer months. But unlike New Zealand, we do not have control of our borders, and that makes total elimination practically not possible. It does remain, though, our strategy to suppress the virus to the lowest possible level of elimination that we can. Despite that situation, we took the decision to get the virus, the infectious pool, to the lowest possible level over the summer months and keep it there for as long as possible. That allowed us to build our public health infrastructure even further, and that included our Test and Protect service. Buying that time means we can now take a more targeted and focused action than we did in March. We do not have to go back into full lockdown. We're not closing schools, colleges or universities. We're not stopping manufacture or construction. We don't all have to stay at home, shut the door and only come out for a brief period of exercise. And those who made some of the hardest sacrifices of all, the 180,000 people who shielded, can bring back some more normality to their lives. We're not stopping the remobilisation of the NHS, and we're not shutting off access to residents in care homes. But more targeted measures are, by necessity, more complex. That is the trade-off. We could take simpler action. Full lockdown is simpler to communicate, and it would suppress the virus. But as we've said and as we've seen, full lockdown can't last forever. The virus doesn't go away, and full lockdown causes harm to our economy and jobs, to our mental health and well-being. So with all of that, we have learned and continue to learn about this virus and what we need to do to suppress its transmission and its harm. We must ensure life goes on, and we must keep people as safe as we can. Yes.
Anna Sarwar.
I thank the Cabinet Secretary for taking the intervention. I know what the Cabinet Secretary says and completely agree with her, but I do wonder, I pressed the First Minister on this at First Minister's questions, is do we make an assessment of what the impact is of pausing certain services? So, for example, the pause of cancer services, has an assessment been done of how many more cancer deaths are expected in Scotland as a result of pausing cancer services over the last 6 to 7 months?
Jean Freeman.
So yes, we do make that assessment as we go, and I am very, very conscious of the number of patients who have not been able to have the treatment that they need because we had to lock down those services. And that is precisely why right now we are trying to get the balance between targeted measures and not stopping the remobilisation of the NHS. That is the trade-off. We could lock down completely, the virus would be suppressed, but the NHS would stop doing just about anything except urgent care and COVID. That is not what you want or I want. That's why the balance is important. And the balance is a constant fluctuating balance. It's not one that we reach on a Thursday and it will last us all the way through for the next month. It is constant because the numbers constantly have to be looked at and the advice constantly has to be taken. We announced targeted measures yesterday, which apply from the 16th, for 16 days from Friday the 9th of October to Sunday the 25th of October inclusive. These are a mix of national measures with extra measures that apply directly to those parts of our country where we are seeing the highest number of cases, where we are seeing the virus at its most prevalent. That's Forth Valley, Lanarkshire, Lothian, Ayrshire and Arran, Greater and Glasgow and Clyde Health Board areas. And our measures are targeted at those situations where the virus has the best chance of moving from one person to another. Our evidence tells us that the risk is where people from different households are mixing without consistent protection, including face coverings and distance. That means in people's homes and where people socialise. We introduced strict conditions on mixing in homes 2 weeks ago, but yesterday we also announced measures to limit mixing in hospitality with important exemptions for weddings and funerals. But in the health board areas, if you give me a minute to make some progress, but in the health board, the 5 health board areas with the highest prevalence, we are introducing additional temporary measures. The intention of all of this is that alongside those that we introduced 2 weeks ago, we have with that combination the effect of interrupting the growth trajectory of the virus. But we know that these come at a cost to those businesses and jobs most directly affected, and that is why we have confirmed a £40 million support fund to mitigate against that harm. Ms Bailey.
Jackie Bailey.
Thank you very much, Cabinet Secretary. I wonder whether you could publish the evidence that indicates there is a direct correlation between rising infections and traceability back to hospitality settings. And the reason I ask is I understand that Public Health England have a figure of just 4% of traceable COVID-19 transmissions outside the home. Is there a comparative figure for Scotland? Is that something that Track and Trace have the ability to actually collect?
Jean Freeman.
Yes, we do. And it's not about causality. I think we've gone through this before. But the Track and Trace, Track and Protect is our system. The Track and Protect system has demonstrated between a 20% and up to 26% incidence where people who are testing positive followed through on that system have had those encounters in hospitality. Now, Ms Bailey knows as well as I do, it's not causal. It doesn't mean necessarily that individuals were infected in those circumstances, but it does mean that they were in those hospitality settings. So we have to take that seriously because we know, you know, I know, that the virus transmits itself easiest when we are mixing as individuals and we are not taking all the protections and precautions that we know we need to take. That's why all of us now wandering around this Parliament are wearing masks. We know why we're doing it, why we're following the signs. Mixing gives the virus a perfect opportunity to jump from one person to the next. Now back to the funding. The money needs to go direct to the affected businesses quickly, and we're already engaging with the relevant sectors, including with the STUC. The funding delivered through local authorities will be paid through a two-tier system. A two-tier system consistent with the approach taken in Aberdeen City in August and UK government support for local restrictions in England. I'm happy to accept Mr Cameron's amendment, which seeks more support. We've found all we can, but I'm hopeful that the UK government will soon recognise that support and more support is necessary. There are other important steps that we're taking that I don't have time to go into, but members will know of these from what the First Minister said. I'm happy to accept Alison Johnson's amendment, as we will be reviewing testing to consider where asymptomatic testing can be expanded as capacity rises and in line with clinical advice. We said when we introduced the route map that our approach to the pandemic would evolve. We're in a new phase, and I'm happy to also accept Willie Rennie's amendment, which is about thresholds underpinning application or otherwise of restrictions. Presiding Officer, as the Cabinet Secretary for Health and Sport, I'm acutely aware of the impact of this virus. We all remember the devastation of the first wave, and none of us want to return to that. But action is required. None of us in this chamber disagrees. We are proposing targeted action with financial support. Let me finally pay tribute to our NHS and our carers, our test and protect teams, who are working night and day and tirelessly to do what they need to do to help us protect people across Scotland. But they cannot do that if the virus is out of control. I know people are growing weary, but I have faith in the people of Scotland, in how we do look out for each other, a spirit that has served us well for the last few months. Where we are now will pass. We will move on, but we will only do that if we do it together. Presiding Officer, I move the motion in my name.
I now call on Donald Cameron to speak to and move Amendment 22985.2 for up to 8 minutes, please.
Thank you, Deputy Presiding Officer. Can I move that amendment in my name? Can I begin by setting out the Scottish Conservatives' general position on these measures? We understand why these restrictions are necessary. Cases are rising, prevalence is up, and it's clear the virus is spreading in Scotland, particularly in the central belt, where there are sharper increases. But we've also seen sporadic outbreaks in rural areas, on the Uists, in the Western Isles, for example. For those reasons, we support the general thrust of these measures, and we accept with great reluctance that tighter restrictions are needed, albeit we have some deep reservations, which I will come on to in a moment. And of course, we regret the impact such restrictions will have on everyday life. Yes, there is relief. We are not returning to the very stark, full lockdown we all experienced earlier this year. But that relief is tempered with anxiety. Let us be in no doubt this will be very difficult for many people, especially those in the Central Belt, as they go about their lives. Many will be prohibited from enjoying food and drink with friends, from socialising at events, and from spending time at leisure facilities. It's going to be very tough to take, even for a short time. People are being asked to give up a lot when they've already made many sacrifices, and the country has been through so much. But while we will always support measures that are proportionate and protect public health, our support for these measures is not unconditional. We have very serious concerns about the knock-on effects of some of these restrictions, particularly the impact on certain parts of the economy, which will be severely hit. Let me turn first to hospitality, and there is no doubt that this sector will be significantly affected, even with a temporary shutdown. Reserves were already low, confidence was shot, and many businesses were still on their knees, let alone picking themselves up. Pubs, bars and hotels were relying on a busier end of season than normal this month before winter really kicks in. And as we know, pubs and restaurants are now closed across the Central Belt completely, and elsewhere in the country are facing limits in terms of stricter curfews and in terms of where and when they can serve alcohol. That will particularly affect smaller and independent businesses, especially family-run ones. And in short, as others have said, these measures will be catastrophic, and I don't shirk either from describing them thus. Now, it's easy to think of this only affecting hospitality in its own silo. That isn't true because there is a supply chain here, and there will be suppliers, wholesalers, connected businesses who will also be affected, especially in the wider tourism sector. And can I illustrate that with an example of someone from the Highlands and Islands who wrote to me just this morning? I was emailed by a B&B owner on Skye, and she said that she relies on local restaurants and bars being open for guests to get food in the evenings. Guests come and stay particularly to go to these places and will probably cancel their visit if they cannot eat and drink there. She operates a 5-day cancellation policy, so she faces the unenviable decision of whether to charge someone for a stay they no longer want due to measures that have come with no warning. That's just one example, and there is a lot we still don't know. We urgently need details on the promised £40 million support package from the government, and I listened very carefully to what the Cabinet Secretary said. But we don't know, how do businesses apply? Where do they apply? What's available in terms of funding? What are the conditions? How long will it take to get support? And will this financial package be enough? What we do know, indeed.
John Swinney.
I'm grateful to Mr Cameron for giving way. I'm following his speech with great interest because he said at the outset he recognised the necessity for more significant action. And he's now set out arguments against what the government has set out. I wonder if he could explain to us what measures you think we should take to arrest the situation.
Donald Cameron.
Accept that. I'm not setting out arguments against what has been suggested. What I'm saying is that there are knock-on effects, there are consequences for business that need to be considered. As I've said, what we do know is that the Scottish Government has to ensure these jobs and businesses are supported. And it seems wrong that the government is only now engaging with business affected in that sector, despite trailing the circuit breaker for weeks. Discussions on how to compensate business should have opened weeks ago, and a one-day consultation, literally hours before doors are to be closed, is not acceptable. And CBI Scotland said it was deeply disappointing that firms have been instructed to close before specific detail has been provided on what funding will be made available and how it can be accessed. I spoke earlier about how much Scotland has gone through, and though public compliance generally has been good, things are changing. People are feeling weary as the weather turns and nights darken. We have a long winter ahead. Patience is beginning to wear thin, and in many ways we are at a tipping point. And that means there's all the more onus on the government to justify these measures to us all, not just in terms of the evidence which informs their political decisions, but also in terms of what the rules are, given the increasing plethora of complicated regulations and guidance. And as of tomorrow, we will have an even more complex set of rules. And at the COVID-19 committee yesterday, Jason Leach said himself, if I'm honest, I cannot keep up with all the regulation and advice. There's simply too much of it to keep on top of every day. I will in a second. Now, I both like and respect Jason Leach, and I commend him for his frankness. I sympathise with him. But when the National Clinical Director, someone who advises the government and helps draw up the rules, can't keep up with the guidance, then what hope do the rest of us have?
Jean Freeman.
Well, Mr Cameron, I'm grateful to him for taking the intervention. Will he accept that actually the specific point that our National Clinical Director was responding to was on a specific piece of guidance about physical education in schools that Education Scotland had issued, and that in fairness, he quite rightly said he would write about that because he wanted to be sure that his response was accurate. I don't think it is necessarily obvious then that he does, because he does not know the detail of every piece of guidance, that the guidance itself is complicated.
Donald Cameron.
Well, the guidance is complicated, and I listened very carefully to what he said. And I commend him for what he said, but his comment there was given in general terms. Complexity is compounded by contradictory messages. That inevitably leads to media speculation, which feeds into confusion and uncertainty on behalf of the public. What the public want is clear, simple, and consistent messages. We all accept that things change from day to day, but given the need for compliance and buy-in from the public, it's imperative that there is clarity about what people can and cannot do. And indeed, further confusion has arisen today over whether cafes with alcohol licenses can open, and if they can, how do you define a cafe versus a restaurant versus a pub? The SNP government must clear this confusion up because business owners need to know whether they can open in 2 days' time. I very briefly want to touch on parliamentary scrutiny, which is mentioned in the government motion. We support greater scrutiny by Parliament, and that process should be driven by Parliament. The key problem is one of timing. Yesterday shows us. In the morning, the COVID committee voted on measures which had been announced almost 3 weeks ago. 4 hours later in this chamber, an entirely new suite of measures were being announced. And that's the problem, in my view, which Parliament needs to solve. So,
Mr Cameron's just closing.
I'm afraid I can't. To conclude, Deputy Presiding Officer, we acknowledge the need to react to this worrying increase in cases. We recognise the tough challenge of balancing public health with the need to protect jobs. The measures outlined yesterday are not easy and they are not desirable, and they raise more questions than answers. We have to ensure that our pubs, bars and restaurants are closed for the shortest times. These businesses are on the edge. They've already been hit hard by this pandemic, and these measures will only add to that hardship. It's right they receive financial support, and clarity around that is needed. We can beat this virus. Winter will give way to spring, and it is right that both of Scotland's governments continue to work in partnership to ensure we move in the right direction. Thank you.
I now call Richard Leonard to speak to and move Amendment 22985.4 for up to 7 minutes, please.
Thank you, Deputy Presiding Officer. These are the most difficult of times, and these are difficult calls to make. But as I set out last week, it is paramount that this Parliament is central to the decision-making process and not an afterthought. So we welcome this afternoon's debate and vote, but that must also mean that regulations should be voted on by Parliament before they take effect, not after. We are all agreed that we need a path to recovery, a recovery in health and an economic recovery too. It cannot be one or the other, it is both or neither. And that is why any legislation and any regulations passed by this Parliament must reflect that at all times. We have always said that we must be guided by the evidence, that the gloom of this pandemic must be illuminated by the light of scientific reason. But that evidence, that light, must be trusted by the people. And I take no satisfaction from this. But government ministers know that confidence in the strategy is diminishing, and they cannot console themselves with the laurels of past support. Backing for these new measures, these new restrictions announced to Parliament yesterday, which come into force tomorrow, have not won unquestioning support. We understand that the choices are stark, but they can only be made to work by the establishment of trust and so winning the consent of the people. winning it by persuasion and not by coercion. And the public hesitancy and some questioning which the government now faces is in part, I accept, born out of a fatigue and a tiredness in the desperate search for light at the end of this tunnel. But it is also born out of a growing restlessness and discontent that yet more is being asked without the compelling and persuasive evidence needed to back it up. So to the government I say again that evidence must be published now and in full, and it must differentiate between, for example, different parts of the hospitality industry, not lump them all together. It is not good enough to put all sports activities together. And we need to see more of the detail of household-to-household transmission to understand what is going on, what must be stopped, but also what might be permitted. It's not enough simply to invoke common sense. Trust the people with the evidence, because the selfless sacrifice of the people has been unlimited. The emotional strength, the effort, the endeavour, especially of those key workers who have worked on for month after month with no break, not in the name of anything other than in the name of common humanity. But the selfless sacrifice has also been made through the tears of loss, the desolation of loneliness, and for too many the anguish of ever deeper poverty. And we know that many working people are now facing the grim prospect of unemployment and joblessness in the lead up to Christmas. That is why they want a government and a parliament on their side, defending their right to health, to safety and to life, but also ensuring that they do not pay the price for a crisis that they did not create and cannot control. And that's why we have said that the workers, as well as the businesses impacted by these new restrictions, must be guaranteed compensation. It's also why we are saying that we must use the next 16 days to step up our testing system. We know that weekly testing for key workers is not always routinely happening. Look at those HC1 workers in West Lothian, where frail, vulnerable people have lost their lives, where the testing regime has been rightly described as a shambles. This needs to be fixed. Yesterday, the First Minister spoke of extending testing to more individuals and groups in society who do not have symptoms. And we've asked for more testing of asymptomatic people for months. We've asked for testing of incoming travellers, and we've asked for routine testing to be expanded to home carers. Today, when I asked the First Minister when it would be delivered, I did not get a clear answer. Perhaps I could get one this afternoon. Just this morning, I was contacted by a daycare service worker called Alan, who told me that while staff in care homes are now supposed to have weekly tests, daycare staff and home carers do not. He said, and I quote him, "This week in our place of work, we have had 2 staff members test positive after showing symptoms, and a number of staff are to isolate on the instruction of test and trace. Under the current guidelines, with no routine testing system, it is simply a mystery as to whether service users and staff are spreading the virus in our service. It defies any logic." So to the Cabinet Secretary and to the Deputy First Minister, I say, will you use the next 16 days not just to publish a revised testing strategy, but will you use it to roll out routine testing to staff in Scotland's home care and daycare centres? It's not simply a matter of passing this motion this afternoon or voting for an amendment. It is in the end about winning the hearts and minds of the people and being in touch with what is happening out there in the real world. And that is about asking the questions on any new restriction. The question, is it proportionate? Is it targeted? Will it work? What impact can we expect? And does it have the support of the people? So will every one of these measures be followed not out of a fear of the repercussions, but out of a belief that sticking to them will help us all, out of a sense of social solidarity. So that is the test for the Scottish Government and the test for us as representatives of the people as well. It is a test that we cannot afford to fail. Can I move the amendment in my name?
Now call on Alison Johnson to speak to and move Amendment 22985.3, please, for up to 6 minutes.
Thank you, Presiding Officer. I move the amendment in my name, and I'll begin with wholeheartedly thanking those who've been on the front line, working incredibly hard throughout this pandemic, often at personal risk and cost. I think their dedication and bravery in extremely challenging circumstances is to be commended. And I'd also like to thank all who've been striving to adhere to what have been extremely tough restrictions over the past 7 months. I know that these rules have caused considerable distress to many, and their commitment to following them must be recognised. To suppress and ultimately eliminate COVID, we must all continue to abide by the rules, but none of us should be in any doubt that this is an enormous ask of everyone across the country, young and old alike. We were told in yesterday's report that 38% of people report complete compliance with the COVID measures, and people are beginning to feel fatigued and they need to see a light at the end of the tunnel. So I think transparency is vital, and the objective of these new restrictions must be clearly communicated so that people know that by making these sacrifices, they'll be moving Scotland further towards ending this terrible pandemic. They need to know what will be different at the end of these 16 days. Now, I understand that these measures are intended to act as a short, sharp shock that will give us time to address the rise in the case numbers of COVID-19, to help us prevent its spread. And as the evidence paper states, and the Cabinet Secretary mentioned, a quarter of all positive cases have been linked to hospitality, and that hospitality, we're told in the report, therefore presents one of the highest risks. What then is to stop this from happening again once the restrictions are lifted? If hospitality presents such a risk, what will prevent a similar rise in cases once people are able to attend venues as before? The fact is that unless things change, we face a devastating cycle of lifting and then reimposing restrictions. And this is not sustainable. It's devastating livelihoods. It is costing us so much in terms of all that we've come to expect as a society. And that's why we need to change, and it's why the Scottish Government must use the time that we're buying over the coming weeks. Because yes, defeating COVID, it requires businesses and the public to do more, but it also requires government to do more. And I'd like to focus on two critical elements of the Scottish Government's response that must be addressed: supporting self-isolation to enable and maximise compliance with this essential measure, and rapidly delivering a mass testing programme for Scotland. As revealed by the paper published this week, compliance with self-isolation and quarantine is clearly very challenging. And this is often due to non-voluntary factors like being forced, having no option but to go to work. So it's clear that when individuals are asked to isolate, they should also be offered immediate wraparound support so that all barriers are removed. I mean, how can university students in cramped accommodation with shared facilities, running out of food, with no way to wash their clothes, really be expected to self-isolate effectively, for example? And what about workers on precarious contracts forced to choose between their health or their jobs? The motion states that the Scottish Government will provide support for those self-isolating. I very warmly welcome that, and I appreciate too the fact of the £500 grant, but I'd like to hear more from the Cabinet Secretary about how this grant can be made more widely available and available quickly. I mean, this particular Cabinet Secretary knows only too well the delays in accessing universal credit and so on. So I think speed is clearly of the essence. So, in return for the public's compliance, the Scottish Government must step up to the challenge and establish mass testing in Scotland. This means a new drive by NHS Scotland and Scottish universities to expand testing capacity rather than continuing to rely on the chaotic and failing UK Government's privatised, privately run testing programme. So this extra capacity could mean weekly tests for those who are at heightened risk of exposure to the virus because they work in our hospitals, in our schools, universities and colleges, or provide care. The Scottish Greens have been consistent throughout this crisis that mass testing must form the basis of Scotland's response to the virus, and I welcome the Cabinet Secretary's comments regarding the review. And now, with cases rising rapidly and the privatised UK testing system failing to keep up, this case is stronger than ever. Because the more information that we have about who has the virus and where it is, the more chains of infection we can break and the more lives we can save. I've been calling for weekly testing for carers since April, for carers and frontline NHS staff since April. Now, this has only been implemented in care homes and for healthcare staff working in certain limited circumstances. But the evidence that regular testing can reduce the spread of COVID is irrefutable, with Imperial College researchers advising that regular screening, irrespective of symptoms, could prevent about a third of transmission. No wonder then that this proposal is backed by those who represent frontline workers, including the Royal College of Emergency Medicine, the Royal College of Nursing and Scottish Care. With cases rising, this has to happen now. The widespread outbreaks in student halls throughout Scotland and the UK are alarming. I mean, there's no doubt that many aspects of university life make this sector particularly vulnerable to COVID, and more has to be done to reduce the risk of transmission. And we believe that mass testing can make a major contribution. And this should start with readily available, unlimited, on-demand testing for students and staff by accelerating the rollout of walk-in centres as soon as possible. Presiding Officer, I appreciate that I'm coming to the end of time, but I'd just like to conclude by asking for your support for my amendment. The science is clear that weekly testing is effective at reducing the spread of this virus, and it's high time we got down to that. Thank you.
I now call Willie Rennie to speak to and move Amendment 22985.1 for up to 6 minutes, please.
Thank you, Deputy Presiding Officer. When faced with the prospect of a terrifying disease, we put aside differences and worked with the government and others to save lives and livelihoods. It was what people expected of us, and it was the right thing to do. We put forward suggestions, positive, constructive ideas on pay for frontline workers like nurses and carers, on testing for residents in care homes, on testing of students, support for artists, fishermen, the self-employed, tourism businesses. We made the case for a universal basic income to fill the gaps in financial support. We offered solutions on enforcement and guidance. There was good engagement on issues that needed fixed. We worked in the spirit of cooperation. I found ministers open and cooperative. I am impressed with officials on the councils, in government and its agencies. It showed the vast, massive work that can get done when we put aside the fundamental difference and divide on the Constitution. I have personally complimented, probably too many times, the First Minister on her communications. I continue to support the cautious approach to the virus, weighing up the competing harms on health and well-being, economy, education and others. But I have been tested over the last few weeks, and so have the public. We warned about outbreaks at universities and suggested a programme of testing. That was rejected, and there are now outbreaks at universities. We warned about the inadequacy of the quarantine spot checks, with over 1,000 people now missed from those checks, and the latest figures showing we're nowhere near the 20% that was supposed to be the target this week. And the First Minister admitted holidaymakers returning from Greece brought the virus back and spread it. The talk of elimination over the summer does not look wise today, with an R number up at 1.7 and infections are high. On April the 17th, the First Minister said, "None of us have all the answers. I've got a duty to try to be open with people. I'm treating the public like grown-ups that they are." Fast forward 6 months, and the country gets 2 days' notice of a plan to close pubs and advise against non-essential travel. And with 1 day's notice, some cafes are told they can stay open after all. And my colleague Alex Cole-Hamilton highlighted another element of confusion this afternoon. Is that being open? Is it treating people like adults? I think the First Minister is doing exactly what she criticised Boris Johnson of doing earlier on this year. Yes, briefly.
Rachel Hamilton.
Thank you to Willie Rennie for taking the intervention. I totally agree with you about the lack of notice from the Scottish Government. And Paul Watterson from the Scottish Licensed Trade Association just tweeted and said that this has come totally out of the blue, and really I can't help because we just do not know what it means and there's no clarification. Does Willie Rennie think that the Scottish Government knew that the R number was on the rise and they should have given us more notice?
I think, I mean, to be fair to the government, it's difficult, all this stuff. I understand how challenging it is, but they should let us help, because these are the issues that can be clarified if we can give a certain amount of scrutiny. That's what the Parliament's for, to debate and challenge the issues, rather than them being introduced and having to change them at the last minute, just like we've had today. So clarity earlier. Of course, there's still going to be difficulties. I understand that. But let us help resolve these issues. Over the last few weeks, while the First Minister has been talking in general terms, with very few specifics of a circuit breaker, she should have been using that time to acknowledge that the route map is out of date and openly and debating and discussing a new strategy. That new strategy should include an updated route map and transparency around the thresholds that underpin the implementation and lifting of tougher measures, nationally or locally, to help people understand and contribute effectively to those efforts, and for this strategy to be the subject of a meaningful vote of Parliament. And I am pleased that the Health Secretary indicated that she will be supporting the amendment, because that's those words. That's what we want to see, because we need to look at the issues around about testing that Richard Leonard was talking about care homes and about access for families. We need to be talking about, in a more comprehensive sense, the support for businesses and, of course, the quarantine checks. And there are so many other things that we need to look at and debate openly. Question times are good, but we need to have the debate and the scrutiny. And we should embrace this change, because I think we are seeing the public being tested by the government's handling of the pandemic. People have made huge sacrifices for longer over the summer and are expected to make these new sacrifices earlier than elsewhere. So they need to see the government's workings, because this no longer feels like a strategy, but a series of knee-jerk reactions. And those knee-jerk reactions are causing confusion and frustration. Look at the teachers. Last-minute change to full-time teaching. The students told to go back to university and then told there was not going to be any in-person teaching and they couldn't even go to the union anymore. Restaurants given 2 days' notice, even though they've got stocks of food in their restaurants that will now go to waste. Pubs that were told it was common sense that they were the source of the spread, even though the majority were complying with the government's advice. And yesterday, the First Minister said that people can still go on booked holidays, but also advised that people in the Central Belt should not have non-essential travel outside their own area. No wonder there is confusion. And there is evidence in the evidence document published yesterday about the concern about the potential that the virus will overwhelm the NHS again. Yet we're closing down Louisa Jordan. It just makes little sense. And that's why I'm about to conclude. This is why we need discussion and debate on these issues. We need to have openness and scrutiny of this strategy. We need to see the signs. We need to understand and overcome the confusion. There is growing doubt. As the Minister can tell, I'm irritated by the government's change of approach over the last few weeks. I want to help. I don't want to be irritated anymore on behalf of the people I represent. I want to help, but the government's going to need to change its approach if we're going to be able to do that. I move the amendment in my name.
Thank you very much. We now move to the open debate. Can I remind members who wish to take part in the open debate that they should press the request to speak buttons now? And can I call Claire Adamson to be followed by Jamie Green?
Presiding Officer, thank you. I welcome the opportunity to take part this afternoon. It said hindsight is a wonderful thing, but I think Mr Rennie expects not only everything to be viewed in the lens of hindsight, but expects the government to have a crystal ball and predict how this virus is going to affect us. It's simply not tenable. For me, today, this debate is all about facts. Wear a face covering, avoid crowded places, clean hands and surface regularly, stay 2 metres away from other people and self-isolate and book a test if you have COVID symptoms. This advice is key to each and every one of us as we go about our daily business, and whether that's at work, in study, in our schools or colleges or universities, all while shopping or in our social lives. Can I say, Presiding Officer, that my caseload has many comments about the effing facts, the face coverings. And can I please ask everyone to do the right thing by one another and wear face coverings where required and where appropriate to do so. By far and away, the bulk of contacts remain concerned and in some cases fearful at the lack of adherence on face coverings on trains, on buses and in shops. And this comes also from friends and family. Yes, I'll take an intervention.
Rachel Hamilton.
Does Ms Adamson believe from what she's saying that hospitality businesses have not been compliant?
Claire Adamson.
That's not what I'm saying at all. I'm saying that I am regularly contacted by friends, by family, by members of the public, my constituents who are concerned that face coverings aren't being worn in public places like transport and when people are going to and from their work. The Cabinet Secretary paid tribute to our carers and to our workers in the NHS, and I extend that to shop workers and those in hospitality. They too are essential to our way of life, and we should do the right thing by them in their place of work and on their journeys to work by everyone wearing face masks. I was delighted when the Health Secretary announced that the Scottish Government are working on a card that will be available to those exempt or unable to wear a face mask or covering, and this is extremely helpful. But I do make that plea again for the rest of us: do the right thing. But the other facts at play here are the facts and the scientific evidence published prior to the First Minister's announcement yesterday, and these make for very difficult reading indeed. The rate of the growth of the epidemic is increasing. They are numbered around a range of 1.3 to 1.7. It's leading to accelerated numbers of cases and a rising test positivity rate in most areas of Scotland. We know the total number of confirmed cases is lower than the total number of new COVID infections, as some people are asymptomatic and some people with symptoms don't manage to get a test. Very sadly, the facts show that there is an increase in the number of deaths. Cases are increasing most rapidly for young people, but they are also worryingly increasing across all ages as well. And it is in the context of these scientific facts that the Government has taken the necessary action to interrupt the virus by a series of measures that have been announced. They are tough and they are challenging, but they are absolutely necessary. There has been much asked of the people of Scotland so far, and much will be asked going forward. But it is essential that each and every one of us do what we can to literally save lives. We only have to examine the facts around us, and the Cabinet Secretary alluded to our European neighbours, and it's exceptionally concerning. Recently, Paris hospitals reported a 40% use of ICU capacity taken up with COVID patients. So the French Government has taken action, so bars in Paris will shut from the 6th of October for 2 weeks. University and lecture halls will be no more than half full. And last week, bars and restaurants in Marseille were shut completely for 15 days. Face coverings are compulsory in closed places. And in Paris and in hundreds of other areas of France, anyone over the age of 11, it's compulsory to wear a face covering. Madrid is in lockdown, and we know the Netherlands and many other European countries, Germany, all have had to introduce new measures to curb the increase in the COVID virus outbreaks around us. We are not unique in this. It's happening, it's a global pandemic, and each and every one of our European neighbours is taking the necessary action, tough though it is, to stop the spread of COVID. It is all about the facts. Thank you, Presiding Officer.
Thank you very much. I call Jamie Green to be followed by Fulton McGregor.
Thank you, Presiding Officer. Let's be honest with ourselves. At decision time today, we're not passing regulation, laws or legislation. which will introduce the 16-day shutdown that was announced yesterday. So in that respect, this isn't really a meaningful vote, to use the fashionable phrase. But we're having a debate, and it's welcome, because in just 24 hours, those regulations will affect millions of lives in our country. Many cafes and bars will close their shutters, and I fear some their doors for the last time. But like most folk, I'm trying to balance the need to combat the spread of the virus, whilst also staring down the barrel of economic abyss, because that is the dilemma that all governments now face right across the world continuously. But I want to flag 3 questions with the government today. And my first is this: does the government think that the public have confidence that the measures that we have introduced and will introduce are fair, that they're working, and that they will work? Because we heard from UK Hospitality this morning that there are 16,000 licensed premises in Scotland. And the £40 million announced by the First Minister is welcome, but it's also been described as a drop in the ocean of what is actually needed to keep them afloat. The restrictions that we introduce have consequences, and I think the hospitality sector, who are bearing the brunt of them, in a second, the hospitality sector, who are bearing the brunt of most of this, deserve comprehensive support that is not just obvious to access, but easy to access, because they're running out of cash, Presiding Officer, in days, not weeks. They're at the tipping point after months of disruption. And let's be frank, they have bust their guts for doing what was asked of them by us. One put it on the radio this morning. They said they are stunned, shocked and depressed, and they're not the only one. I give way.
Jane Freeman.
Thanks very much, Mr Green. Will you then join us in urging the UK government to make sure 2 things happen? One, that the furlough scheme is extended and continued and not ended, and secondly, that there is a means by which additional resource can be made available to this government precisely to help those businesses that you're talking about, in addition to the 40 million that we've found, which is as far as we can go.
Jamie Green.
I'd like my time back on that because I've got a lot to get through. What I will say is that the Scottish Government are taking these measures, the Scottish Government are making these decisions. If the Scottish Government take those decisions, they must back it up with the funds that support the businesses that they are affecting by the decisions that they are making. These aren't UK government decisions. These are decisions made in this Parliament. And those sectors, please, those sectors are saying to us, where is the evidence? No. Where is the evidence? Where is the evidence that these restrictions are working? Why does the government believe that if we close cafes and bars, that will compensate the spread of the virus from those who are drinking in pubs, which are regulated, to drinking in their houses, which is not? Where is the arbitrary curfew evidence that 6 p.m. and 10 p.m. works? Who is providing this evidence, and what is the government providing those businesses that they are putting those curfews on? And if the virus is moving from home to home, and it is, if the virus is moving from home to home, why did it not spreading moving from home to home when the areas that we banned people from doing the same was introduced? We had weeks and weeks of that. All people are asking for is evidence that the measures that we introduce are working, because we took a cautious approach in Scotland, whatever your views on that, and all we are being asked is, why are we being asked to do it again? What has gone wrong? And they are rightly asking the government, are you keeping your side of the bargain? Are you testing, protecting, mitigating and preparing? Because if the route map has not worked as planned, why not? I will do my bit, people say, but you also must do yours. My second question is this, and that is, are people confused? And a quick look at my inbox testifies to this, because months of changing regional advice, time-constrained regulations, guidance, laws, they're all intertwined, they're all changing, and they're rarely debated, I'm afraid to say. If we are confused, the public must be also, because that has an effect on compliance. And that is my third and most important question. Will people comply? Because what happens when you stop people drinking in bars and pubs? The rise of alcohol sales in supermarkets and off licences are a testament to what happens. It's no surprise. People gather in houses. So do the police have sufficient powers to prevent this, to deal with this? And do they have the resource they need to do so? Because it is absolutely right and fair to ask, why are we punishing compliant businesses for the recklessness of others? Patience is indeed running thin. And that in itself should be a big red flag to all of us. The freedoms to travel, work, live, love and learn are all the foundations of our society. We took them away because we had to. And we're doing the same again, because we have to. But are we saying today that this endless rollercoaster of locking and unlocking is the government's strategy? Because when we give government those powers to curb our freedoms, it must meet those simple tests. Those powers must be justifiable and necessary. They must be used proportionately. They must be time-constrained, and they must have certainty of ending. The truth is that for so many, they're looking down the barrel and the end is far from sight. We must ask valid, probing and even difficult questions of the government. But that is not the same as denying the need for restrictions. That is our job, that is our duty, and it's one which we all must do better. Presiding Officer.
Fulton McGregor, to be followed by Pauline McNeill.
Thank you, Presiding Officer. I think it's fair to say that yesterday's news of new restrictions came as a blow to many. And you know, that's okay for us to feel like that. As a nation, we've worked hard through lockdown, wearing masks and sacrificing much. And here we are with numbers unfortunately rising again. And I get how people feel. I've had constituents contact me upset that, for example, long-arranged plans to meet up with a friend or a family member are now off. And it is, we're living in scary times. But to me, what is even more scary is the increasing rise in numbers of infection, hospital and ICU admissions, and sadly, of course, deaths. We absolutely must do something to try and arrest the course of the virus and prevent further lockdown. The outcry, as others have said, would be so much worse if we simply sat here and done nothing. And that's why I fully back the First Minister's announcements yesterday for these new short, sharp measures to get COVID-19 back under control. But Presiding Officer, I want to talk about how people and businesses in my constituency have been affected by this. There can be no doubt that the hospitality sector is taking the brunt of these new measures, and with already a difficult year since March behind them, I know they're beginning to feel a wee bit singled out. One constituent who works as both a bar manager and in a local primary school emailed me last night to say she felt that there was much more risk of transmission in school settings than in hospitality, where mitigation is in place. I hear this, I hear what she's saying and other similar opinions that have been expressed in the Chamber, and I know how much mitigation has been put in place to minimise risk. Indeed, Owens Bar and Coatbridge have been commended for their response after being identified through contact tracing as a part of an outbreak in Lanarkshire connected to Sittle back in July. But we know also that this virus transmits in places where people congregate together, and we know that although much lower than in households, hospitality is a source of spread. Therefore, we must do something, and do something now. I believe what we do need to be thinking about now is how we support the sector, and I welcome the £40 million investment and we'll wait to hear the details of this. But businesses in Coatbridge and Christon that contacted me last night feel it may not be enough, but early indications to them suggest that. If that is the case, then we must listen and do what we can. And if it means we need to the UK government for further discussions about more money or extending the furlough scheme again, then no, then so be it. And no one should lose their job in my constituency or elsewhere as a result of this 16-day circuit breaker. And we all must work together across governments and local authorities as well to make sure that doesn't happen. And also this must include other sectors that have remained shut, like soft plays, for example, an issue I've raised in here and with the government several times before. Also, I think the other thing we can do is think about how the hospitality sector can move forward after the 16 days. For example, does the 10 PM curfew need to stay? I think there are already concerns about this, as we've heard. Quite well documented, people may go back to houses at closing time. Let's use these 16 days to consider the evidence. Is the virus spreading faster or slower with the curfew? I don't know, but it would be good to have the discussion about it. And music, the owner of a local pub and club, Envy in Coatbridge, has raised the issue of background music with me. He says that no background music has actually, in his establishment, led to more people talking louder and actually increasing noise levels and risk. Now, I hadn't actually thought about it from this angle before, and I'm not particularly sure what the science says. I'm quite open-minded, but again, what does the evidence say? Has the ban on background music slowed the spread of the virus or not? So coming out of these 16 days, let's give hospitality something to hang on to. And in fact, I hope that it may be even better for them than if there was no circuit breaker. So I suppose to have a hope of a better future going through the winter. Background music and curfew times are just two examples. But I do feel that having these conversations, we will bring the sector with us and I know that the Scottish Government will do that. Like others, I've also had contact about adult sports and clubs and also classes such as parent and toddler groups. The news the other day about baby and toddler was very welcome, but I think with all these things, and like the hospitality sector, I think we need to think about how they may turn in a safe way after these 16 days that will give hope to some people moving forward. Sometimes these classes or activities are the difference between people being isolated or not, or having good emotional health or not. And again, I know that the government do give consideration to all these things. Presiding Officer, I do also want to raise some of the household restrictions that have been brought to me by constituents, specifically whereby an individual in a relationship can't meet their partner indoors because one of them lives with other people, perhaps parents. I would ask that these types of restrictions are thought about in the coming weeks with more bespoke solutions found, perhaps utilising testing where possible and if necessary. I do understand that this is really difficult, but I think we all know that it's house parties and mass indoor gatherings that are the major cause of concern. And if we're going to have this virus with us for a long time, I think we do need to find ways to distinguish between the different types of gatherings. And I know and appreciate how difficult that is. Presiding Officer, because I'm on screen, I'm not actually sure what time I've got left, but I'll simply end by emphasising that I fully support the measures introduced yesterday. This government have always put the health and well-being of the nation first and foremost. 7 months in, the balance is becoming more difficult to get. I welcome the proposal of additional parliamentary scrutiny and would suggest that it's for all of us across parties to raise our constituents' concerns and work together collaboratively to find the right balance in all areas of our life while keeping everyone safe and driving this virus back. Thank you.
Thank you very much. Mr McGregor makes the case for reliable timepieces for those making remote contributions. Can I call Pauline McNeill to be followed by Christine Graham?
Thank you. Yesterday's announcement by the First Minister was a very sad day for the hospitality sector. At least we all agree on that. Stephen Montgomery of the Scottish Hospitality Organisation said it signed a death warrant where the problem is socialising at home. The vast majority of businesses in the sector have adhered to the guidelines and made sure their establishments are safe. They knew how much was riding on this. I visited O'Neill's last week, a pub in Glasgow. It's orderly, it's clean, you can't go to the bar, you're waited on in tables. They are devastated by yesterday's announcement. And it's easy to understand why they feel over-penalised by the latest round of restrictions. And I have to pay tribute to Paul Waterson, because throughout the 6 months of the pandemic, he was very understanding and fair about the fact that hospitality couldn't open up. And the fact that he is criticising it this week speaks volumes. The lack of consultation, as Richard Leonard talked about today, means that we're already having to make corrections to the understanding of cafes and licences. So many changes that they've had to keep up with, and now what is a bolt from the blue, with less than 48 hours to shut down their operation, they have to decide how they're going to deal with their staffing arrangements and decide whether they can survive for another 3 weekends with no business. I have to say, if Philip McGregor is listening, it's not short and sharp. And I think it's naive to think that people will not lose their jobs, because people, unfortunately, will lose their jobs unless they can get some guarantees from government today. I would, however, agree with Philip McGregor about the 10 p.m. curfew and the background music. And if he is listening, I hope he'll sign my motion on that, which is very reasoned and measured. The £40 million that's been set to cover 15,000 businesses seems an awful small amount of money. I do not think the sector can survive. I ask the government, in fact I plead with the government, to reconsider that, because if this is meant to be mitigation at these figures, it will not be. Whether you think the new rules are justified or not, one thing the government does have to do is to make some assessment of the losses incurred by these businesses. And I don't know that that has been done. The SGC and Unite have said they've already been hearing reports of employers asking already precarious workers to shoulder the pain and take long sustained periods of unpaid leave. I think Patrick Harvey mentioned it today. So we need to make sure that the funding package, whatever it is, reaches workers as well. The next aspect I want to talk about this afternoon is to have a serious discussion with politicians, with communities and with government ministers about a step change in our approach to this virus. We've already had many questions and discussions about the accuracy and the speed of testing and track and trace. It's better here in Scotland, but it isn't as good as it should be. But there is a poor level of compliance, and that's partly why I think the hospitality sector are also questioning the data behind it. A recent study showed that those who were reported being alerted by the NHS track and trace service where they had close contact with a confirmed COVID-19 case, only 11% reported that they had not left home at all in the full 14 days. And the 18.2% who showed symptoms isolated, meaning that the rest didn't. Now, I think if these figures are true at all, and I can cite the study, I think there's going to have to be a serious look at that. I think perhaps that's what Claire Addison was getting at. But we can't stand still, and we need to look again at testing. We need testing in the community in order to live with the virus. And what I mean by that isn't just what we've been discussing the last few weeks. Testing is an industry, actually, that is not standing still, because many people understand that they can make money from it too, and that's fair enough. Saliva tests, RNA lamp tests, it's a moving thing, and we need to have a discussion on what kind of tests will be acceptable to the government. So I know that there's ongoing discussions with aviation at the moment, and I'm pleased about that. But they need to discuss some of the detail about how they don't impact on current capacity. Italy is carrying out tests on arrival at airports, and they give the result in 30 minutes. Jersey Airport is testing people on arrival. And the World Health Organization put a plan together at the end of last month to roll out 120 million rapid diagnostic tests to help lower and income countries fight the virus. Presiding officer, just my closing seconds. I think that we all believe, I suppose, I hope that test is the way. If we're going to live with the virus until a vaccine is available, we need to step up our approach to saying what kind of tests can work. In aviation, live music, in football audiences, this is the way forward. And I just close on this. I do understand, I've just discovered this afternoon, that Jeff Ellis and others have been discussing, on behalf of the live music sector with DCMS, a way forward that could be tested. So this is the direction I think we need to head in, Presiding Officer. I'll finish at that. Thank you.
Thank you. I call Christine Graham to be followed by Stuart Stevens.
Thank you, Presiding Officer. Pandemic, lockdown, self-isolate. How quickly these terms have become part of our lives. 7 months ago, confined to my home with just a short walk each day, I learned new skills, Zoom and Teams. I kept a diary of those weeks, partly to give structure to the day, partly as therapy, and perhaps to look back one day in those dark times. But there were bright moments when I spoke to neighbours I never used to see during the working week, and later clapped along with strangers in distant tenements for carers and health workers, an emotional demonstration of community. Why say this? Because we were then truly all in it together. Fear, absolute fear of the unknown, united us in purpose, kept us sticking to those rules. The impact on those living alone, and particularly for some who are elderly, was and is very, very hard. Not all elderly people are in the same boat, of course. We are as diverse in our health, our personal circumstances and temperaments as the next. But we have one thing in common. We are more vulnerable statistically to severe reaction to the virus than almost any other group. Now, there is some suggestion, not in this chamber, but with growing traction, that politicians should change tack, that even targeted lockdowns are not working, that as the economy cannot take much more of this, we should let the majority of the population move about more freely, perhaps even give that elusive herd immunity a chance, and protect the elderly and vulnerable. Trouble is, no one has, to my knowledge, told me what that protect involves. Is it the option of personal lockdown for an indeterminate period, or take your chance and go out and about? To me, that's like asking us to cross a busy road without looking right and left. On the fringes of this proposition, some even say that, well, they've had their time. So, que sera, sera. Quite apart from ignoring those younger people with underlying health problems, such as cancer or MS or diabetes. You know, as you get older, in many respects, life becomes more precious. You no longer take it for granted. Yes, of course, the economy, jobs, have to be protected to the best of our collective ability. It is distressing to see family businesses in my constituency on their knees, to read the emails of desperation. So there must be Scottish Government and UK Government support for these to see us through to the spring at least of next year. Furlough, whether sectorally targeted or not, must be reinstated. And those who must isolate must know they will have financial support, because it's clear from the figures yesterday that it's a minority which comply. And I welcome the recently announced Scottish Government support within the constraints of its limited budget. And that's the key, a limited budget. But the major intervention to allow businesses to function is what we do ourselves. We know how the virus operates, through us, through our need to socialise, to be close to others. Back in March, we understood that, and perhaps through naked fear, we complied. Now those scary words, pandemic, COVID, have become familiar. And with that, as the adage goes, comes a degree of contempt. Of course, test and protect is important, but not a panacea. That strategic approach, which I welcome, won't be worth the paper it's written on if some of us continue to defy what we know is required. Keep to those rules, not just for ourselves or granny or grandad, but strangers we'll never know, and in so doing, also give the economy a fair chance at recovery. Thank you.
Thank you very much. I call Stuart Stevenson to be followed by Rachel Hamilton.
Thank you very much, Presiding Officer. And I want to pick up on some of the things Christine Graham has just been saying and earlier Claire Adamson, because testing is something that's preoccupied quite a few speakers in this afternoon's debate. But of course, testing has to stand second to the behaviours that we adopt, a long way second. If you doubt that prioritisation, just think about what we've seen happening in 1900 Pennsylvania Avenue, otherwise the White House, where the President of the United States has been tested for COVID every single day for a very long period of time. But it didn't protect him from catching the disease because the behaviours that he adopted and many around him were not safe behaviours. It's the behaviours that protect us. Testing is important because it's a component of understanding where the disease is going and how we can follow it as it passes from one person to another to cut off further sources of infection. So it is vital that we have a good testing system. I've read that there's blame being attached to software in England that was used for doing some of the statistics associated with this pandemic. Using 13-year-old Excel software was not intrinsically a problem. The software wasn't to blame for the difficulties that were being experienced in calculating the people who were tested positive. The problem was the lack of professionalism of people who use the software. It's like blaming a 4-seat car for being unable to carry 2 soccer teams to a match. The car was designed for 4 people to be carried. The 22 people in a soccer team are the normal thing. We can't blame the car, whether it's new or 20 years old. It's the person who decides to use that car in the way that they did. And so it is that the deficiency that has been attributed to software is actually a deficiency in the professionalism of the people who were using it. And I think, in a sense, that goes to the heart of who we have as our experts. With software, we need to have experts who understand about software. Now, I speak with a particular interest as a professional software engineer, not the only one in the Parliament. And indeed, I have software that I know that I wrote more than 40 years ago, which is still used every week millions of times. So age can actually bring maturity. And let me just go to that issue of age. I heard Richard Leonard say that we should have no restrictions until they've come to Parliament and been approved there. I absolutely say to Richard, I took my first driving test in the year in which he was born, and I don't want somebody to have to stop me stepping in front of the traffic that might be coming down the road. Christine Graham referred to that, by going to Parliament to get permission first grab me and then post hoc homologate the decision that's made. And that's the approach that we need to take with this pandemic as well. Now, I've used the word expert, and it's important that we do have all the experts that we require to hand and the statistics that they can gather and explain to us lay people who have to make the decisions. I don't envy the Cabinet Secretary for Health. I certainly don't envy the First Minister. I congratulate them on their fortitude in the face of a most impressive workload. I can't believe that it's possible for them to be doing anything than about 40 hours a day. It certainly looks that. But the expert is somebody who brings expertise to the problems that we have to meet. And they do so without bias and without taking a prior position. Now, we've heard quite a lot about the economy, and I agree, it is vital that we protect our economy, and that's why the money coming from the Scottish Government is very much to be welcomed. The hospitality sector has suffered in particular, and there are many, many small businesses that we need to be careful to support. But there are others, such as Tim Martin of Wetherspoons, who initially refused to pay his staff. He's worth about £500 million, and he stopped paying his suppliers. I don't want to be particularly supporting the Tim Wetherspoons of the month. I do want to support his employees, because that's very important. Presiding Officer, I'm delighted to see that we've got a broad consensus and will support all the amendments, bar the Labour one that is before us tonight. I very much welcome this debate. Presiding Officer.
Thank you. I call Rachel Hamilton to be followed by Richard Lyle.
Sorry.
Order, please. I'm called Rachel.
Thank you, Presiding Officer. I refer members to my register of interests. We know COVID-19 cases are rising across the whole of Scotland, and this is very concerning for businesses operating in an already fragile and fast-changing environment. Let me be clear, the Scottish Conservatives support measures to bring the R number down and to curb the virus, but we are asking for clarity over the detail and the decisions. As my colleague Donald Cameron said, this is a worrying time for businesses. Many thought they had weathered the worst of the storm just to be knocked back again. The economic implications of this pandemic and the new lockdown restrictions will be catastrophic for businesses. Not my words, but the words of Willie MacLeod of UK Hospitality. Others have been clear, as Pauline McNeill said. Stephen Montgomery has called the measures a death sentence. Let us be clear, the frustration has been borne by the nature of the 11th hour government restrictions, which has wounded a £14 billion sector and put a good chunk of the 206,000 jobs on the line. Yes, we do welcome the 40 million to support closed businesses, but require detail regarding the eligibility that the First Minister talked about today of the two-tier process based on rateable value. Does it require full lockdown or partial lockdown? Perhaps the Cabinet Secretary could clarify that in his closing statement. Presiding Officer, the SNP have neglected to bring on board the hospitality and tourism sector in their latest round of restrictions. Businesses employ people, they pay taxes, they are the beating heart of our economy. They deserve to be consulted prior to any decisions coming down the line on more restrictions. Moreover, this sector has a duty to their employees to give them certainty and reassurance so that they know that their wage packet is on its way. Mark Crothall of the Scottish Tourism Alliance set the record straight yesterday when he said the details of the new restrictions as announced by the First Minister this afternoon, which will come into force in just 2 days, are nothing short of devastating for the majority of those operating in the hospitality industry. The same knee-jerk reaction happened recently with the self-catering industry. The Scottish Government knew for weeks that the R number was on the rise, yet they did not give the self-catering industry notice, causing widespread cancellations, especially in the run-up to the October holidays. Knee-jerk reactions are causing economic damage. Furthermore, restaurants plan shifts 7 to 10 days in advance and orders are placed with wholesalers up to weeks ahead. We heard yesterday from Ian Gray that Green King are making redundancies and they own Belhaven Brewery in East Lothian. This is just an industry left in tatters, Presiding Officer. Once the data finally was revealed, the Scottish Government admit that it cannot be entirely attributed to hospitality. Between 20 to 26% of individuals who have tested positive have been exposed in a hospitality setting. Fair enough. However, as the Cabinet Secretary said, the data does not indicate where people who have tested positive were infected. It is not a measure of causation, except if there is an outbreak. Yes, I'll take an intervention.
Jean Freeman.
Thanks very much for that. I'm sure that the member understands that it is not possible to actually get to binary causation data that will tell us that. But what we do know, what she knows, what I know, is how the virus transmits itself between one person and another. So the more you've got people in any particular setting, household or hospitality, the greater the chance of virus transmission. That's what we know.
Rachel Hamilton.
I think the evidence needs to go further, Cabinet Secretary, that there was no consultation with hospitality businesses regarding this. It's literally, you're throwing them off a cliff. Yep. So the measures announced yesterday tar all hospitality businesses with the same brush. And this was echoed last night on debate night by Stephen Leckie. He's the CEO of Crieff Hydro. Making bars, pubs and restaurants the scapegoat will not bring back jobs and livelihoods. The measure also infers that this sector is flouting the rules, galling for those who've complied implicitly with them. Protecting jobs in Scotland should be top priority, with new restrictions being introduced. Many across the tourism and hospitality industry welcome the additional funding. However, raise concerns it simply doesn't go far enough. Businesses on the ground simply have no detail if and when they will receive a portion of the funding. This was echoed by the STA, but there is again concern that it isn't sufficient to protect businesses being forced into potential full-time closure with job losses incurred. Moving to testing, the Scottish Conservatives want to see testing increase, they want to see capacity increased, and we want to see a commitment to putting more boots on the ground with the Test and Protect staff. We know that it is improving, but 925 people haven't been traced who tested positive since the 22nd of June. And with the R number increasing, that is actually quite concerning. In conclusion, Presiding Officer, a total lack of planning and prior consultation with businesses has caused heartache and confusion. It's just not sustainable, as Alison Johnson said. The hospitality industry in particular has suffered immensely over this period, and they demand clarity. This is the least this government can do, get the balance right. All parties are calling for sensible measures in the amendments today. They deserve a lifeline, and the offering on the table from the SNP, I'm afraid, is not good enough.
Thank you. I now call Richard Lyle. Richard Lyle will be the last open debate speaker this afternoon.
Thank you, Presiding Officer. Since March, we have witnessed the tremendous efforts of the people of Scotland to try and deal with an unseen, untouchable virus. A virus which has affected every one of us, the world as a whole. A virus, sadly, that looks like it won't go away anytime soon. We're in a pandemic. We need to deal with it. And I wish to thank everyone, including health professionals and everyone who kept their services running. Every grocery firm, every local shop deserves our thanks for what they continue to do during this pandemic. Yesterday's announcement affects many in central Scotland. At the start of March, we as a family decided that my daughter and my grandchildren would come to stay with my wife and I. We formed our own bubble to ensure that I could see them every day. I know it's not been possible for many grandparents. Over the last month, there have been many changes and restrictions on where you can meet. It's been hard for families, grandparents, not seeing their grandchildren. And then, when they do, having to answer the question, Grandpa, why don't you give me a hug? I've been lucky during the lockdown, been able to spend a lot of time with my grandchildren. More time with them than I ever spent with my own children, as I was always out as a counsellor, balancing 2 jobs during that time. I've taught my granddaughter Iona to ride a bike, although Iona would say she taught herself. She now calls me Grampy. I'm sure colleagues in this place will now change that to call me Grumpy Grampy. My grandson Rory is an expert in building Lego. He asked me to help him to build a monster truck. But I had a Microsoft meeting that day, and I said I wouldn't be long. But as usual, party meetings go on, and he built it himself by the time I finished the meeting. As it says in the government motion, I note the prevalence of the virus has increased in recent weeks, and that numbers of people have been hospitalised. In intensive care and tragically dying from a virus that has increased. This is a trying time for us all. As I previously stated, in my constituency, Highgate Care Home was the first to contract COVID-19. My brother was in that home. They faced the challenges, and he was in a care home that gave him excellent service. He was in a 5-star hotel. Sadly, as I said, my brother died, but not from COVID-19, and I thank that home again for letting me see him before he passed away. I agree that further actions need to be taken in order to reduce the level of transmission across Scotland. I note the evidence paper published on the 7th October, the national and regional targeted actions set out by the First Minister. I, for one, recognise that these actions will be accompanied by additional measures that will have to be explained to boost compliance. The public want to know, and they want to know the reasons for restrictions. During the last months, we as councillors, MSPs, MPs have seen a tremendous growth in our daily emails, asking us for every reason under the sun why this is closed. We have to give reasons and take people with us and show people why we have to close. If we have to close them down, even for a short time, we should help them financially. COVID-19 has been a learning curve for us all. I pay tribute to our Cabinet Secretaries and Ministers for their extra work. And a special thanks to the Cabinet Secretary for Health. You and the First Minister have made choices, not mistakes, in my mind. We have provided support for those self-isolating, financial support for those areas of the economy impacted by the measures announced yesterday. Well, I welcome the ongoing Four Nations discussions and shared commitment to suppress COVID-19 to the lowest possible level across the UK and keep it there. And yes, I believe there should be a commitment to explore additional parliamentary scrutiny and commitment to bring forward an updated strategy approach to COVID-19 transmission to this Parliament shortly. During this pandemic, there have been many issues to deal with, and I've asked many questions and got many answers. Many inquiries have been made to the health-related, and I encourage the Cabinet Secretary that we ensure that where we can, operations start again, that cancer treatments continue or restart. COVID-19 is very important, but so are all the other health issues that affect everybody and affect people in my family. We have to be able to get the flu jab if we wish and visit our GP when we can, or at least virtually meet them. One subject which I constantly raise is the subject of dental treatment. So I have to ask, what reply if I had to give to a constituent with a chipped front tooth, diagnosed as needing a non-urgent filling, not having the treatment currently completed under NHS? However, the same patient is able to have the same problem fixed by the same dentist in the same practice on the same day with the NHS if they can afford to pay for the treatment. It cannot be for science reasons, as the procedure can go ahead with the correct PPE. So what is the reason for the two-tier system of dental care currently operating in Scotland? This is one of the other choices that have to be made, and I hope we will get back to normal. When, I don't know. Possibly when a vaccine is found. I've seen many posters in the last months. I think the best one is, we're all in this together. Yes, we are. I personally thank everyone for what they're doing, what they can do for their fellow human being, and say to all, stay safe.
Thank you. We now move to closing speeches, and I call Alice Cole-Hamilton.
Thank you very much, Deputy Presiding Officer. I'm glad to be closing for the Liberal Democrats in tonight's debate. Presiding Officer, at the start of the debate this afternoon, we heard from Donald Cameron, and he quoted the National Clinical Director, Jason Leach. And the Cabinet Secretary understandably took exception with that, because those remarks were out of context. But nevertheless, I will repeat them again, because within them there is a very eerie echo to many of the emails that we are all getting from constituents across the country. I can't keep up. If honest, I'm with all the regulations and all of the advice, there's simply too much to keep on top of it every single day. Presiding Officer, even if he didn't mean to say those words or they were taken out of context, we are all Jason Leach today to some extent. It was telling that one of the most important clinicians of the government would say this, because it echoes those hundreds of emails that we get every single day. And the measures announced yesterday are not necessarily clinical decisions, but they are political ones as well. Now, I accept that given the nature of the emergency, by necessity, a lot of this is guesswork. A balance has to be struck between infection control and livelihoods, between protecting the NHS and protecting people's mental well-being. And I do not doubt the intentions of the First Minister or her Cabinet Secretary, or the place where any of this comes from. But there is massive confusion out there. And so it is every time there is a rule change that I and you spend the next few weeks mopping up inquiries. And the First Minister must know by now the level to which people have begun to hang on her every word when she makes announcements like the one she did yesterday. And, Presiding Officer, words matter, and in statements like that, clarity is everything. So when she says, in practically the same breath, that her government are not insisting that people cancel their October week staycation, but advises against all travel outside of their region unless absolutely necessary, what are people supposed to think? The First Minister has to realise that such is the commitment of normal people to do their bit in the national effort to fight coronavirus, that the assessment of whether to travel from Edinburgh to a hotel in the Highlands, say, will be laced with guilt. Small wonder then that on Radio Scotland this morning, Stephen Leckie, the CEO of Crieff Hydro, revealed that within an hour of her statement yesterday, 50 bookings had been cancelled for the October week. Her words matter, Presiding Officer, and they have consequences. The Liberal Democrats have worked as constructively as possible from the start of this emergency to support and amplify the government messaging around infection control. We continue to do that to this day. In the foothills of the crisis, they were very good at including opposition politicians in briefings and in decision-making, and that approach was very welcome. But as my leader, Willie Rennie, said, that over time that has fallen away. Briefing and consultation have started to become an afterthought. Indeed, Presiding Officer, it says a great deal, I think, about the diminishing effort of the government to include opposition parties, that the last time I met with the Chief Medical Officer in my role as Shadow Health Secretary, that CMO was Catherine Calderwood. Now, I've not raised that with the Health Secretary or the CMO. They've got much better things to do than meet with me. But when I am tasked with explaining the changes and the measures imposed by her government, and the rationale behind them, to literally hundreds of local people who get in touch with me every week, I am nearly as in the dark as my constituents. How can you have 50 people at a Sunday worship, but only 20 at a funeral in the same church the following day? Why did the science suggest that 5 adults was the absolute maximum limit for parent and baby classes last week, but allow it to double to 10 this week, and only if your child is under 4 months? Why is it that until this morning, cafes in the Central Belt could stay open, but cafes with on-sales licences, like Craigie's Farm in my constituency, could not? Now they can. But pubs which can switch to providing breakfast, coffee, soft drinks and meals still can't. I will from Rachel Hamilton.
Rachel Hamilton.
You sound as though you're speaking from a point of view that you've read the instructions. So I'm wondering, if you had a pub in Glasgow and you suspended your licence, do you think that you'd be able to open until 6 o'clock in a lockdown area?
Alex Cohall.
It's almost like we rehearsed this, Rachel Hamilton, because I'm coming on to that in my next breath. For example, in her intervention earlier, in my intervention to the Cabinet Secretary earlier, the Cabinet Secretary said, I often criticise her for confusing guidance, but as Rachel Hamilton has just alluded today, I would say that the hundreds of emails to licensing boards right now asking for a temporary suspension of liquor licences is evidence of just how clumsy this measure is. That business owners of this country are crying out for clarity from your government, Cabinet Secretary. Their survival depends on it. I don't have time, I'm afraid. I know this is hard. I know that the government and the Cabinet Secretary are doing their best, and I do not doubt their intentions. But a route map is only a route map for as long as you know where you are on it. And I don't know that any of us here in this chamber tonight know whether the 5-stage route map revealed to us this Parliament in May even exists anymore. I can't help but think that if you had brought us with you, as you did at the start of this emergency, included us in the discussions and shown us the evidence as the adults you promised us that we were, we could have helped you. We could have helped you to have seen that hot-housing thousands of first-year students without a testing regime in place for their arrival would lead to mass infection. Helped you to work with the licensed trade to remove the risk of alcohol to social distancing while keeping those businesses on a paying basis. Helped you to better understand the well-being needs of those bereaved families who cannot grieve together in a place of worship. Now, I'm not saying that our ideas are any better than yours, but surely getting us back to where we were at the start, feeling our way through the crisis together in co-production, and giving us some ownership of those decisions your government takes will better equip us to bring our constituents with you too on this awful journey that still lies ahead. Take us with you. We do not want you to fail.
Thank you. I now call on Andy Whiteman.
Thank you very much indeed, Presiding Officer. And this has, I think, been a welcome and somewhat overdue debate, because it's understandable in the early weeks and months of this pandemic, Parliament's role in scrutiny of the Executive was necessarily limited. As Donald Cameron pointed out, we've passed regulations weeks after they were made and come into force, and indeed we'll do so again this evening. And we've done our best, I think, broadly speaking, to scrutinise the ongoing policy decisions of Scottish ministers. But we now stand, I think, at something of an inflection point. COVID has and always will be primarily a public health crisis, but it's rapidly became and continues to be an economic crisis. And although it's no longer a political crisis, it is now a broader political issue. That's to say, it's been running for so long, it continues to have such a profound effect, and will do so for months to come, that the public is becoming increasingly confused and tired, and risks thus becoming a wider political issue. So the commitments from the government to engaging with Parliament over a refreshed strategic approach is welcome, because there needs to be wider buy-in, as many members have said, and consent to the measures put in place to eliminate COVID. And to do that, I think we need to address four key aspects of the governance of this crisis. So first of all, there's the science. Now, it's widely available, it's being published on open access terms, and that's all good. Much uncertainty still exists, indeed much dispute still takes place, but that's normal in scientific inquiry, and we can leave that to one side. Second, there's the evidence. Now, helpfully, ministers are now publishing more of this in a more timely fashion. Yesterday's example was a good one, although evidence can be selective, partial and biased. By and large, the evidence we have is useful, although there remain much more that could be shared. And Jamie Green asked, in fact, about the impact of household restrictions. Well, they're actually set out, in part at least, in figure 12 of the evidence we got yesterday. Third, and importantly, are the options and advice provided to ministers by official. Now, none of this, to my knowledge, has been published or shared outside of government. And then fourth, are the decisions themselves and the guidance and regulations associated with them. And it's the second and third I want to focus on, because first of all, on evidence. For example, we know between the 28th of May and 4th of October that 14,997 people were recorded as index cases in the Test and Protect system. We know that 65,755 contacts were traced. Of those 65,000, we know that 48,243 are unique individuals. But that leaves 17,512 individuals who are associated with more than one index case. Some of them will be associated with two, but some may be associated with dozens. So, for example, what do we know about those 17,000 people? And this, of course, relates to the K number, which is a measure of how concentrated the pattern of infection. Is it a few people spreading to many, or is the spread more evenly distributed? And does the Cabinet Secretary know what the K number is, or what the distribution of those who've been in contact with more than one index case is? And that's just one example of evidence I think may well exist, be useful to have in the public domain. More importantly, however, is the third factor, the options and advice which are given to ministers, and that's not the same as the evidence. Now, I think it needs to be shared more widely. Now, I know this is not routinely done. I know it can compromise frankness in engagements between officials and ministers, but we are at a stage, I think, where it's vital to public confidence that the public know what the options are or were before the decisions are made, what the pros and cons of various approaches are, and why, specifically why, the government have decided on any particular course of action. Now, the Cabinet Secretary argued in her opening remarks that Parliament should scrutinise decisions, and we've done our best, but I do not think we can fully scrutinise decisions if we're not fully informed of the options and the advice that were made available to ministers. And options and advice is not the same as evidence. Evidence has been published, we need more, sure, but it's the advice and the options and the judgments that were made, which are presented as fait accompli, but we don't know what the counterfactual is, we don't know what the alternative might have been. Because if we're not more transparent and more inclusive with the decision-making process, we should not be surprised if public consent starts to erode to a point where it may very well be difficult to re-establish the levels of compliance we need to eliminate the virus, and we're already seeing levels of compliance quite poor in very critical areas of our strategy in Test and Protect, self-isolation, for example. And a fundamental part of all of this, of course, is the increased testing, as my colleague Alison Johnson argued in her opening speech, and is outlined in the Green Amendment. In most cases, testing is still only accessible to people who are suffering symptoms or who have been in contact with someone with COVID-19, and this will prevent some seeking testing immediately, as they may wait until they're convinced their symptoms are COVID before seeking a test, for example. Now, to ensure that such cases are identified, testing for those workers who are most at risk of exposure, who are not part of a weekly testing programme, should be allowed access to a test regardless of symptoms. And that would include, for example, retail, hospitality staff, people working in the kind of enclosed environments that have been identified as posing significant risk. Because this is already taking place in other countries. New Zealand, for example, engages in routine testing of border workers, asymptomatic at-risk groups such as health workers, hospitality staff and transport. Key in our approach also is ensuring the well-being of those most at risk and those workers who face the greatest risk to their livelihoods. And I would urge ministers to respond promptly and constructively to the letter sent by the STUC to them today. Scottish Greens, presiding officer, do support a precautionary approach to dealing with the pandemic. As the virus is spreading in the community at an alarming rate, it's clear further action needs to be taken to halt the spread. We recognise, however, the huge toll that months of restrictions have taken on people's mental health, on workers and the livelihood of many small businesses. And while 2 weeks ahead may seem a relatively short space of time to those who are isolated, experiencing mental health problems or having to shut down their businesses, it may seem a lifetime. So, conclusion, short of the climate crisis, this is the most critical issue facing most of us in our lifetimes. Government cannot do this on their own. To their credit, they've recognised that. The public need to be on board, but for that to happen over the winter months and perhaps much of next year, we need a new and inclusive participatory approach to assessing evidence, devising and appraising options and deciding on the best way forward. Thank you, Presiding Officer.
Thank you very much. And I now call Monica Lennon.
Thank you.
Thank you, Presiding Officer. The opening line of the government motion asked the Parliament to recognise the considerable efforts of people across Scotland to suppress COVID-19. And on behalf of Scottish Labour, I want to repeat our thanks to the public for their compliance, for their care for one another, and to the frontline workers who have kept this country going. The impact of COVID-19 has been devastating. Our thoughts are with everyone who has lost a loved one to this virus. No one in this chamber underestimates the severity of this illness and the need to stop the virus in its tracks. In June, the Scottish Government said Scotland wasn't far away from eliminating coronavirus, and if we all followed the rules, then we would keep the virus at bay. The public has followed the rules, and that's why people across Scotland have reacted with dismay at these tough new restrictions. Despite the public's sacrifices and cooperation, we are now facing a huge growth in the pandemic, with accelerating numbers of cases and growing positivity rates in most areas of Scotland. And whilst we welcome the evidence paper that the government published yesterday, ministers must do more to improve transparency. Measures are being brought in with little or no time for Parliament to scrutinise them, and we're moving on to the next set of restrictions, just as people have been getting used to the previous ones, and that's where the public are starting to lose patience. People are asking, where is the evaluation of what works and what doesn't work, and what will the measure of success be for these new restrictions? And I think Andy Whiteman has just covered it excellently when he said that, for us as MSPs, we want to be better informed. We want to see as much as possible the modelling, the options, the different scenarios and the advice that ministers are receiving. 2 days ago, the Cabinet Secretary, Mike Russell, said to me that there's possibly too much information being put out there in the public domain. But it's not just about volumes of information, it's about the quality of what we are all getting. And I don't think it was when Professor Jason Leach said to the COVID-19 committee that he himself struggles to keep up with all the guidance and the speed of change, I don't think we should criticise Professor Leach for saying that. I think ministers should reflect on actually what it is like for the public and those small businesses who are trying really hard to keep up. Professor Leach also said the two biggest factors affecting the spread of the virus are human behaviour and test and protect. So if we all agree that compliance with the restrictions is high, then we have to look at the record of Test and Protect. The First Minister has consistently argued that Test and Protect is working well. The Health Secretary last month said she wanted to use testing to actively hunt down the virus, and that is a sensible strategy. But over 6 months into the pandemic, we are still falling far short of WHO advice to test. Every week, Scotland still has thousands of tests going unused, and for months, experts such as Professors Linda Ball, Debbie Schreider and Sir Harry Burns have consistently called for routine mass testing, including of asymptomatic individuals. But the government has been slow to act in this way. And why has unused capacity not been used to expand routine testing? Scottish Labour strongly believes that everyone in health and social care should have access to regular testing, including family carers, but also other frontline workers, including teachers. Why was there not the foresight to ramp up testing capabilities before bringing thousands of university students into halls of residence? Regrettably, there is a danger that the Scottish Government is being complacent on Test and Protect. The outbreak at Red Mill Care Home in West Lothian, raised by my colleagues Neil Findlay and today Richard Leonard, where it took over a week for staff to be tested, is, I believe, a shocking example of where Test and Protect is not good enough. Alison Johnson is absolutely right on routine testing, and she pretty much says it every single week. And concerns are growing that a stop-start approach to lockdown will be disastrous for our economy and for jobs. That's why Scottish Labour is calling for full financial mitigation for all workers and businesses. Many are on a knife edge today, affected by the announcements that we heard yesterday. But we're also clear that we are strongly against the exploitation of workers, especially in the hospitality sector, where many are low paid on casual contracts and in precarious work. And I was quickly looking it up on the Parliament website, Presiding Officer, but my colleague Richard Leonard recently lodged a motion on a good business commission, and I would urge colleagues from across the chamber to sign that. Because, for Presiding Officer, £40 million, which I know others have welcomed, including Jamie Green, it's not going to go very far. Industry is saying it's a drop in the ocean. And I just want to give one example. I know that many MSPs have also had this email today, but Ten Hill Place Hotel, run and operated by Surgeons Quarter, a wholly owned subsidiary of the Royal College of Surgeons in Edinburgh. The Managing Director, Scott Mitchell, has said the hotel provided a safe, controlled environment for healthcare workers who tested positive and required to self-isolate from their households, and at the start of the pandemic provided free accommodation to NHS staff. The hotel has now entered, and this will be familiar to many hoteliers, a negative pace, meaning more cancellations than bookings. They've already made staff redundant, and he's making a point that others have made in this chamber today, that if you engage with stakeholders as much as possible, then we will avoid some of the confusion that we've heard about in this chamber. So I would encourage ministers to take part in that early consultation. In conclusion, Presiding Officer, we all want to defeat the virus, but we also need to prevent increasing harms in other ways. Excess deaths, mental health crisis, social isolation, jobs and opportunities gone, poverty increasing and hope fading, all whilst COVID is still rising. The people of Scotland have made considerable efforts and sacrifices. We know it's going to be a tough winter, especially for our NHS, so we would encourage this government, and both governments actually, to urgently redouble efforts on testing and to act quickly to prevent catastrophic job losses so that no worker or business is left behind.
Thank you very much. And I call on Oliver Mundell to wind up for the Conservatives.
Thank you, Presiding Officer. Reflecting on this afternoon's debate, I recognise that reimposing major restrictions across the country, and particularly in these 5 large health boards in the Central Belt, is an extremely lonely place for the government to be. But we must remember it isn't anywhere near as lonely or as desperate as the position that many businesses are left in, with their employees and communities desperately waiting for news on financial support. And those particularly in the hospitality industry and the associated supply chain are being asked to take the brunt. Strong language has been used this afternoon, and I think we can all understand the anger. It was always going to be impossible to please everyone. This is a public health issue, and it looks likely there are going to be difficult and unpalatable decisions that need to be taken for some time to come. We accept that. But what we cannot accept is at times the confusing way in which these changes are announced and the shameful lack of detail when it comes to lifeline support to protect jobs and livelihoods. As my colleague Donald Cameron set out, the country is increasingly wary, and it was a point made by many members. Morale is extremely low, and we've captured some of that today, which is why it was important to have this debate. Like many, I wanted to believe that the elimination strategy was succeeding, and I suspect that the Scottish Government and the First Minister were hoping the same. But months on, it's become clear that elimination is a long way off, and we face a cold and dark winter after so many sacrifices have already been made. I cannot imagine how it feels to be one of those who missed out on saying goodbye to their loved ones, to have been told that my planned surgery or health treatment wasn't important enough to go ahead, or to have missed out on taking my exams and leaving school with my friends. That's not to say there were any other good options, and I think Andy Whiteman made a very important point when it comes to setting out what those options are and what they could have been. But no matter what choices we make, we must be aware of how much we are asking people. And it's in that spirit, as Jamie Green has argued, that I believe it's imperative that we answer and ask some of those difficult questions now. What will success for these measures look like? What if they don't work? And what modelling have the Scottish Government done on the expected case numbers we anticipate seeing when we get to the 26th of October? Maybe, certainly.
Andy Whiteman.
I thank the member for taking a minute to ask what success looks like. And I broadly agree we need a better grasp on what success looks like. But there is some evidence from figure 12 about reduction in exposures of confirmed cases in family clusters, friends, family and friends gatherings. So there is some evidence that the measures taken a few weeks ago were successful. I entirely agree with him. We need more of that. But does he accept that some of the evidence that's coming forward is quite encouraging?
Oliver Mundell.
I would be loath to use the word encouraging because I think it's still very hard for people to accept that those measures are needed. And I think it comes from a natural human instinct, because we all look at ourselves and our own situations, we all look at our own families, and it's difficult to understand that our actions as individuals have such a collective impact. And that's where I think it's really important. As we've heard today, one of the other key themes to emerge has been inconsistency or perceived inconsistency around many of the restrictions and the accompanying guidance, because I think where that confusion exists, it's harder for people to follow what they're being asked to do, and it's more difficult to justify it. And I think if we don't get this part of the process right, there's an increasing risk that a number of people will decide stuff this. And I don't say that lightly, and I would encourage everyone to follow the advice they're being given. And I disagree with the Cabinet Secretary. I think it was really important that Jason Leach was willing to say that it was difficult to keep up with the changes. I know he was asked about specifics. I heard the Cabinet Secretary say that. He was asked about specifics, but we all have specifics in our own life. Everyone faces specific circumstances, difficult choices, difficult issues within their own family and day-to-day life, and they have to deal with a plethora of guidance. People who send their children to school, people whose children go to sports clubs, people who go to their workplace. They face different rules, restrictions, slight variations in almost every setting they go into. And it is hard for people to follow that. It is hard. And I think the First Minister is right to talk about balance and the need for common sense. But the frustration for many people who are determined to do the right thing is that they are struggling to understand the logic and see how these different decisions fit together. With more thought and contingency planning, and ultimately more consultation with experts in industry, some of this could have been avoided and some of the practical answers could have been given ahead of time. As Rachel Hamilton highlighted, we saw this issue only 2 weeks ago with self-catering, where there was a mix-up in what people were being asked to do. I'm not criticising the Scottish Government for taking these decisions, but there's no way that anyone can think it's fair that when taking decisions that destroy and damage people's livelihoods, that sending out mixed messages and treating businesses and people's businesses as an afterthought is acceptable. Personally, when it comes to the changes announced yesterday, I find it disappointing and astonishing that there was no time to properly engage with the hospitality and tourism sector ahead of those announcements being made. After all, we'd had weeks of speculation in the media that something like this was coming and being considered. I think what's even more galling is that after 6 months of going it alone, the First Minister found time to speak to opposition leaders on top of briefing the media twice, but did not find the time to pick up the phone to those most directly affected. That, to me, is not leadership, and people deserve better. We, after all, must remember, Presiding Officer, that in taking these difficult decisions in Government and in Parliament, we are not the ones paying the price for these measures. We don't have to let staff go. We don't have to close the doors on businesses built over many years. The only thing we can do is provide the right support and, most importantly of all, provide it in a timely manner. What's been offered so far is insulting, both in terms of the sum and the lack of advanced clarity on eligibility. Imagine the anxiety this will cause, on top of telling many businesses in October that outdoors is the only option at a difficult time of year. What a bitter pill to swallow after many businesses have spent thousands of pounds trying to do the right thing, doing what the government has asked and keeping their customers safe. We can do far better, and we can start by stopping curtailing the endless speculation ahead of these announcements. Either the Scottish Government is a very leaky ship, or people are deliberately briefing proposals out to the press. This helps no one and contributes to unease, and it has destroyed what little confidence is left. What's worse, in between all of this, the consultation and communication have not been right. Today's debate has been an important opportunity to air those issues, Presiding Officer, and it has been a start on the much-needed return to parliamentary and democratic scrutiny. While ultimate responsibility for these decisions lies squarely with the Government alone, it is right that Parliament has a greater voice, and this is no longer a short-term emergency, but a long-term reality.
Thank you. And can I call on the Cabinet Secretary John Swinney to wind up our debate? Mr. Swinney.
Thank you, Presiding Officer. And this has been a helpful and informative debate. And I think it's addressed the most important question, which will, and on this point, I think there has been very broad agreement that there was a necessity for us to take further action, and that obviously the Government set out yesterday the basis upon which we had decided to do that. And the necessity for action is demonstrated in the evidence paper that was published by the Government yesterday, which of course comes along with a huge amount of published data on a daily basis about the development of the pandemic, with further time series of information that reflects the pattern of the pandemic. And I want to highlight from the evidence paper 3 particular graphics which I think tell us important points. The first is figure 2, which is the estimated total number of infections, which illustrates that at the current rate of infection growth of 7% increase per day, the number of infections would be at the level of the March peak by the end of October. That one illustration, to me, is the compelling indication of why further measures are required to be undertaken, because faced with that evidence and that data, I cannot see how it would be possible to say that there is no case for action to be taken. And that point has been, I think, pretty broadly accepted across the Chamber. Of course, arguably.
Jamie Green.
Many thanks to the Deputy First Minister. Those are concerning figures. I don't think anyone disagrees. But why does the Deputy First Minister, we are at that stage where having not taken intervention we are agreeing to now, we would be in that situation? Because presumably with all the measures we've introduced, all the lockdowns and all those restrictions, we would not expect to be at that position. What's gone wrong?
Cabinet Secretary. I think what is happening is that a virus which, although we had suppressed it very, very significantly within Scotland, had not disappeared. At no stage has this virus disappeared. But what we are seeing in Scotland, England, Wales, Northern Ireland, the Republic of Ireland, countless European countries, the United States, is that the virus makes a reappearance and a reoccurrence. and that's because it is transmitted by human contact and human interaction. So to address directly Mr Green's point, the government has, yesterday wasn't the first time we took further action. We took further action a fortnight ago, which was to tackle the issue of household gatherings, and we had to put in place very tight restrictions on the ability of individuals to meet in households and essentially stopping people meeting in households indoors. And this is where I come to the second chart, which is the one that Mr Whiteman has just highlighted, which is figure 12, which is the percentage of COVID-19 cases that were exposed to different settings per week. And what that data shows, I want to draw 2 points out of this data. One is that there is a declining proportion of those cases attributed to family interaction in family settings, which I think should give us some encouragement that the measures that are being taken by, as a consequence of the restrictions we applied a fortnight ago are beginning to have an effect. And as our clinical advisers have confirmed publicly, in the west of Scotland, they were blunting the rise of COVID in family settings. But the second point I draw out of that illustration is the point on the hospitality sector, where we see the hospitality sector, it's difficult to draw a direct line, but generally showing an increasing proportion of cases attributed to the activity within hospitality. Of course,
Oliver Mundale.
I fully recognise the point that Deputy First Minister is making, but does he understand the frustration some of these businesses feel, having spent thousands of pounds and a lot of time putting in measures to be safe? I'm not saying it's wrong conclusion to draw, but does he understand the frustration they feel?
I completely understand the frustration, but what we have to, if we answer the first question that I've posed from the first graphic, is there a case to act further? And I think there's a compelling case from that illustration, figure 2. We then have to think about what to do about it. Figure 12 says to us the first thing you should try to do about it is limit household interaction. And we did that a fortnight ago. There is some grounds for encouragement here, but it's not enough because of figure 2. And then we have to look at the other causes, which is what takes us to hospitality. I completely understand the frustration on the part of the hospitality sector. That then brings me to the third illustration, which is the number of new cases in the last 7 days per 100,000 by age group. And this is where I come to the contribution of Christine Graham, which I thought was a very compelling contribution. Because although the largest number of cases per 100,000, not quite the largest number, but a very large number of the cases per 100,000 is in the 0 to 19 years, that group has largely become static. The worrying elements are the growth in the number of cases in the recent 7-day period in age groups above 40, because that is when we start getting into the really acute issues of hospitalisation and ultimately, sadly, into fatalities. So I think in the marshalling of that evidence, there is a compelling case for us to act further. We have taken the steps that we've taken on the hospitality sector. The government engages regularly with the hospitality sector. We have frequent discussions with the sector. Fergus Ewing, as the responsible minister, is in constant dialogue with the hospitality sector and has been throughout the issues in relation to the pandemic. Of course.
Brian Whittle.
Very grateful to the Cabinet Secretary for taking an intervention. Would he, I listened very carefully to the answer that Cabinet Secretary for Health and Sport gave to Alex Cole-Hamilton's intervention earlier on. I wonder if he would accept there seems to be an anomaly between cafes with a licence being allowed to operate, but restaurants who can offer exactly the same service not being allowed to operate. I wonder, is there something, a movement in there perhaps the government can look at again?
But see, the point we come back to here, Mr Whittle, is that we have to take sufficient action to address the danger that's in figure 2 that I've talked about. If we don't take enough action, if we exempt everybody from the action, then frankly there's no point in taking the action whatsoever. We have to take enough action to try to reduce the opportunity for social interaction to enable us to interrupt the spread of the virus. Now, on the amendments, the Health Secretary has set out the Government's position on a number of the amendments. On the Labour amendment, We can't support the Labour amendment. It makes reference to full financial mitigation for these circumstances. We'd love to be able to give full financial mitigation, but we don't have the resources, nor do we have the scope to borrow to enable us to do that. And so we are putting in place £40 million of Scottish Government resources. We hope that the United Kingdom Government, as they reflect on some of the same dilemmas that we are reflecting on here, if Mr Kerr will forgive me, I'm required to wind my comments up. We hope the United Kingdom Government, who I suspect, and Mr Mundell made a comment about the Scottish Government being perhaps pre-advertising some of the direction of travel. If I was looking at the newspapers this morning, I think the United Kingdom Government was setting out perhaps where it will perhaps move, and that may bring further financial resources which the Government will consider as to how we can deploy those. The last point I want to make, President Officer, in closing, is on parliamentary scrutiny, because this has been a very welcome debate. The Government's very happy to come here and debate. We've debated COVID on a number of occasions. There have been a myriad of questioning opportunities. As far as I'm aware, every invitation to Government Ministers to appear before the COVID Committee has been accepted and fulfilled. Indeed, the Health Secretary and I were at the COVID Committee, I'm going to say last week. It was last week, yes. It feels like an eternity ago, but it was just last week. The Government is absolutely willing to engage in all manner of parliamentary dialogue on any of these questions, and we look forward to doing so with Parliament, because these are vital issues. But I come back to where I started. If we are faced with compelling evidence to which we have to respond, the Government has to take the difficult decisions, and there are no easy decisions in all of this. We will engage as much as we possibly can do, but ultimately we have a duty to protect the public and to take the actions which we consider to be necessary to enable us to fulfil that objective.
Thank you very much, Cabinet Secretary. That concludes our debate on COVID-19.